And I also do a procedure called a bit seat. The bit seat is, for people who ride, it's like night and day. You have a horse that's fractious, that's a monster, it's giving you all kinds of problems. Here's a rostral hook. Rostral just means to the front. It's a hook on the upper molar. And I'm going to pass the skull around in a little bit, showing you a before and after on a horse I did with a bit seat. What we did is we took the hook away, but we also rounded the front of that tooth. The reason we round it is when you pull on the bit, you pull that soft cheek tissue into a tooth. If the tooth has edges on it, that's going to cause the horse to become fractious. So here is, let me find my skull. It's one of these skulls. And there's this one, that's right. And this one. Yeah, it's this one. That's it. Here's the skull. Bit seat on this side, no bit seat on this side, okay? I'm going to probably, since there's a few more people here, I'm going to pass the mandible around. And it's the same thing. Bit seat on this side, no bit seat here. Now you can see that the lower, it's called premolar, it comes to a point. These teeth are rectangular in shape, and the back and the front actually come to a point. That point will jam into the soft tissue when you use the bit. Even if you have light hand, you're still going to pull the tissue towards the teeth, and it'll actually make it uncomfortable. But what I want you to do is run your finger like this on the one with the bit seat, and then run your finger this way on the tooth without the bit seat. And just imagine that soft tissue in the horse's mouth with your hand with that metal bit pulling into the teeth. Which one's going to be comfortable if you were that horse? So I'm going to pass it around, and if you want to just slide your fingers on that. Feel it has a spike there. That'll make the horse throw its head up, pull the reins out of your hand, all kinds of horrible things. If you can hold it, because we're going to pass it around. Everyone can take it for a bit of a walk. So that's a lot of times, people who have a horse that's fighting them. And I remember this years ago, before I got into this industry, I used to do 3-day eventings. I've done dressage and jumping, and a lot of horses that are fighting me. I'm thinking, maybe I'm going to go get a milder bit, a more elaborate bit, and I would do what I shouldn't have done. Was the horse is having bitting problems, so I would get a slightly stronger bit. That was the way people would think. Get a more powerful bit, so the horse won't rip the reins out of my hand. Maybe it's just different trainers. You all try different things. Well, that was really the wrong thing to do. Well, a horse's mouth doesn't go from being a nice mouth to a hard mouth, unless you've got awful hands. If you're the same rider and you're riding with a nice light touch, which I believe you should do, then the horse's mouth shouldn't progressively get harder. If the teeth go bad, then the mouth is going to be more difficult, and the horse is going to fight you, so you're going to have a different mouth. So if you change the bit, you might force the horse into listening to you, but it's only doing it with more pain on top of pain what it already had. So the idea is not to necessarily punish the horse by getting stronger bits. Do the teeth, especially have a bit seat put in there, and then you'll find that a lot of times the bit you were using all along is just fine. The horse is just trying to signal you, saying, hey, my mouth is uncomfortable. If you use this bit with the pressure you were using before, I'm going to fight you now, because now it's hurting me more than it used to. That's why the bit seat's really, really important. And obviously the sharp points and all the other things that go with it. And now I've done most of what I want to say, and then I'm going to open the floor for questions too. There's a system called the Trident system, and it's a numbering system. Anyone who does dentistry that charts the mouth, when I do a dentistry, I actually do a full diagram that I give you a copy, and I keep a copy, and my vet who comes with me, she keeps a copy. The numbering system basically identifies which tooth I worked on. So when I do the horse's teeth and there's a wave complex or there's uneven incisors, I document all that, and my clients get a copy for the records, because usually when you get the horse's teeth floated, you get them floated and you don't know much else what happened. So the numbering system just refers to the tooth. There's a 100 arcade, the 200 arcade, it goes 100, 200, 300, and 400. So I'll refer to a tooth on my paperwork, and basically show that maybe the 106, which would be this tooth here, was over long, it was hanging over, so I reduced it. If there's a wave complex, if there's a rise in the lower molars, I'll indicate it by the number associated to that tooth. So at least when you get your chart, you know exactly what was, because it's hard for you to see what's going on here when I'm working. So I give that to the client so they have something, and maybe, who knows, I'll get hit by a truck tomorrow. If I'm gone and someone else needs to come and see that horse, a year from now they can look at the paperwork and say, okay, this horse had a rostral hook, it had a wave complex, and someone who knows what they're doing can read my paperwork and see what the problems were previously, so they can see, usually these problems are reoccurring every single time. If they have a wave complex, they'll always get a wave complex. It's one tooth being slightly stronger than the other, and it's dominant, so it wears out the opposing tooth. So that wave complex has to be addressed every year, or it will return. You don't just correct a wave complex one time, and then it goes away for life. It has to be maintained on a yearly basis. So if they have an overhanging molar up front, the rostral hole. You don't just do that one time either. That'll keep repeating itself if not addressed on a regular basis. So, now given a basic explanation, and you've got a bit of an idea how the development of the teeth are, and that type of thing, I want to open the floor for questions. So, if anyone has questions, feel free to fire away. Yeah?
How long is the horse's average tooth?
How long? Usually around 3.5 to 4.5 inches long, depending on the size of the horse. A miniature horse would be a little bit smaller, but about 4 inches is about atypical. And actually, there's another thing I wanted to mention as I was talking. I keep remembering different things. Find the right skull. They have enamel in their molars, and they have cementum and dentin. Enamel being the strongest, cementum the second, and dentin the third, as far as the strength of the tooth. When there's enamel on the teeth, that's at their strongest, but when they actually get to the end of the tooth, when the root that was down here works its way all the way to the top, they get a condition called cupped teeth. It becomes very, very smooth in there. That's because there's really no enamel left in the tooth. It's primarily now cementum and dentin, which is much softer. So the opposing tooth, if I can find the skull, belongs to the opposing tooth. Typically will be longer. If I have a hollow spot here, I have a longer tooth there. Let's just see how it fits. See? Here's a long tooth, and there's a hollow section. And here's a long tooth here, there's a hollow section. This has more enamel, so this dominated the opposing tooth and wore it down. Unfortunately, in this horse, when it was alive, there was gum tissue right there. So this tooth is pushing against the gum. That's why sometimes horses eat very slow, because as they're pushing down, the dominant tooth is pushing into gum tissue, and it's hurting them, so they've got to eat really slow. What we'll do with a horse this old, we're not going to necessarily make it eat better as far as masticating the hay. We're going to take away the pain by reducing the teeth that are excessively long, so that way they're all equal length, and there's no one tooth pressing into the gum tissue, which makes them uncomfortable. But that's the idea. When they get really old, the idea is just to get them comfortable again. And if the teeth aren't too far gone, we can restore the mouth, and they can properly masticate food, which helps avoid a lot of problems. Also, colic can be a problem with horses with bad teeth. They have to break their food down to a certain particle size. It's actually quite small, it's about 3 millimeters, in order to digest it properly. The worse the teeth, the larger the pieces of food are that they chew and masticate and swallow. And larger pieces of food are harder to process, therefore you're going to invite colic. When the teeth are done, they're going to chew their food more thoroughly. You're going to be able to digest it a lot easier. Therefore, your incidence of colic is reduced. It's not going to stop it altogether, because there are other reasons horses have colic, but you want to at least limit the frequency of it, or hopefully eliminate it completely. It's nice if the horse doesn't have colic, but at least doing the teeth keeps it where it's not as frequent, other than moldy hay or too rich of food. But the hay is a good quality, and the teeth, if they can masticate the food and they don't have sand in their intestines, at least the food masticating side of it has been addressed. Okay.
Now what about diseases? Because I have a client's horse that has diabetes and has no teeth.
No teeth. How old?
How old is the bone?
Is the Cushing's disease what it has, basically?
20 to 21.
Cushing's horses tend to have a lot more tooth problems. They have a lower, the resistance to infections is not as good, and they tend to get abscess molars and infected teeth a lot easier. So those horses tend to have more problems. Obviously, diet's going to be a whole another area.
That she rescued him. He was a disaster when she got him.
Yeah. But any horse, obviously, has got no teeth. There's not much we can do. Is it completely no teeth, or is there still some teeth in there? The reason I ask is if there are some.
He has front teeth. No, they're all gone.
You got to be careful too. If there's 1 or 2 teeth left, those teeth are still coming in, and if there's a few teeth left, they will actually keep erupting up and push into the jawbone. So that if there are a few teeth, they need to be reduced. If there's no opposing tooth, they just keep coming up. They'll come up and actually push up into the gum line and be horrible. So it's more so with a horse like that critical that every tooth is reduced to the same level. Because here's a horse that lost a tooth, and you can see where there was nothing opposing it, that tooth just kept getting longer and longer, and it just, it causes its own set of problems. So once a tooth is lost on a horse, even if it's just one, that opposing tooth has to be maintained every year, because it's going to keep on erupting. It's sort of like growing, but it's not. It's going to keep coming up, and because there's nothing there to wear it down, they'll just keep getting longer and eventually cause all kinds of headaches. So it's more important when they lose a tooth for that to happen. And here's another one.